Welcome back to Search for a Cure. As the U.S. prepares for Thanksgiving, the number of Americans seeking a coronavirus test is surging, putting a strain on the testing system. Lines in cities like New York stretched for blocks and had residents waiting as long as 4 hours for their turn this week. Labs that process results have warned that supply shortages will lead to more delays in getting results, especially as demand for tests surges ahead of people planning to spend Thanksgiving with their loved ones. Let's bring in Dr. Bernard Ashby, Miami cardiologist and Florida state lead for the Committee to Protect Medicare. Dr. Ashby, welcome to the show. A lot of people think taking a coronavirus test to meet up with family for Thanksgiving is the safest thing to do right now. Sir, I have to ask, do you agree?
So thanks for having me. It's a pleasure to be here. As far as that is concerned, there is really no 100% way to prevent the spread of the virus other than preventing interaction. This virus is purely predicated on behavior, and so tests are not 100% accurate. So if you're concerned about spreading the virus, especially if you have a vulnerable family member, the best way to avoid spreading the virus is not to have any interaction at all.
Good advice. You know, many people don't understand the difference when it comes to rapid testing and lab testing. Dr. Ashby, can you walk us through it?
Yes. So you have to make the distinction between diagnostic testing and screening testing. So really the gold standard of testing for COVID-19 is PCR testing, which basically amplifies the genetic code of the RNA from the virus. Now, that test is not 100% accurate, but that's what we use as a reference for the other tests. Now, there's other forms of testing that are molecular tests. So in terms of molecular tests, there are rapid tests that you can do. So there's the Abbott ID Now. There's also the Q Health and some other ones that are available. And they're more accurate than the antigen tests, which just look at a piece of the virus. And that has much less accuracy, more specifically, much less sensitivity. So you have a much higher rate of what we call false negatives. And therefore, there is a concern that you could potentially test negative and still have the virus. So if folks insist on seeing family, I do think it's a good idea to at least get tested. But the rationale behind doing the test is to say that if you are positive, then you know that you have no business over there. But if you are negative, you still should operate as though you have the virus and practice all of the appropriate safety protocols.
I do want to expand a little bit more on that. Do you believe test results will be accurate enough for people looking to gather around for this holiday season, for Thanksgiving next week?
So again, testing is not 100% accurate. And so there is a chance of having a false negative result and actually being at a family gathering. We have found out through a ton of data, surveillance data, that the asymptomatic rate of COVID-19 is north of 40%. And what we found is that, and this was actually mentioned in the COVID task force meeting yesterday, that the main spreaders of this virus are asymptomatic individuals, particularly kids. And so, again, I don't recommend that you use a test as a 100% fail-safe way to determine if you're safe to interact with any family members. Again, particularly vulnerable family members who suffer the worst outcomes.
What can we learn, Dr. Ashby, from Canadian Thanksgiving? What did they do right?
So the Canadians in general have taken this virus very seriously, and their public health messaging was far superior to ours. The politicization of the virus is not anywhere near what we have in the US, and they have much more trust in their government as an institution. So when they did give directions and guidance to the public, they followed them. In the US, unfortunately, a lot of folks still believe that the virus is not real. They don't believe in mass use, and they feel like any restriction on their behavior is a restriction on their rights as an American. And what we've been trying to inform the public, or trying to tell the public, is that, listen, this isn't really a political issue. I mean, people are literally dying. We're north of 250,000 deaths already, and that's going to accelerate with this surge. And so, you know, it's an unfortunate consequence of poor leadership, if you ask me.
The CDC is urging all Americans to not travel for Thanksgiving, but we also know 50 million Americans are still expecting to travel and do just that. Do you think Thanksgiving could turn into a super spreader event?
Yes, we fully expect that. Again, this virus is predicated on behavior, and during the winter months, people tend to be more inside. They tend to have the windows closed and the heat on, and that's the perfect recipe for the way this virus spreads. I mean, if you share air with anyone, particularly in a room that's not ventilated, that's when people get sick. And so the concern by all over the healthcare establishment is that when folks travel from different parts of the country to homes and they interact with family members that they haven't interacted with in weeks, months, even years, there is an opportunity for this virus to be transmitted from one person to another. So this is an extremely alarming scenario. This is kind of like the perfect storm. And by all accounts, this is going to lead to, to magnifying a surge just already out of control.
I'm curious to know what you think about my next question, because we know thousands of college students will be heading home this week, next week for Thanksgiving break. Do you think colleges should be testing these students, and should they be advising students to maybe stay on campus and not make the trip home this year?
Yes to both, definitely. So students, they can be vectors, as I mentioned earlier, about interacting with family members that you haven't interacted with before. They can definitely be vectors for the virus. As we know, kids or students are much less concerned about their own health, and they do engage in much riskier behaviors. And so when they leave their dorms or their campus and then go to family gathering, they are going to be the likely vectors to spread it to their entire family. And so testing on the campus is one way to prevent that. But again, testing is not 100% accurate. But if they can't control that and students do choose to visit their family members, I do think it's a really good idea for them to get tested. So if you do have positive students, at least they will know and they can then self-quarantine and not be a potential vector of spread in the family gathering.
We appreciate your time and insight, sir. Dr. Bernard Ashby, Miami cardiologist and Florida state lead for the Committee to Protect Medicare. Thank you again.